Do some celebrities have a death wish? What the hell is pink cocaine?
Pink cocaine. Pink cocaine.
Could the deaths of big-time stars like Matthew Perry, Liam Payne, Prince, and dozens of others have been prevented? Drugs in Hollywood. Wow. It's a great topic, and we are all over it today. Welcome, everybody. Tom Zenner's Scandal, co-host of One Degree of Scandalous with the one and only Cato Kalin.
So good to be here.
It's been a while.
Listen, I can't believe that. We have a doctor here today, and seriously, already, when I met him in the green room, he asked me to cough twice. What's up with that? I mean, what is
Generally,
going?
You volunteer that for people, anybody on the street.
No,
Can I cough for you?
Only TSA.
Yeah. Hey, Cato, this is going to be a hell of an episode. Liam Payne of One Direction falls over, is pushed over, jumps over a three-story balcony in Buenos Aires. Matthew Perry, of course. You know, even Diddy, even the story with Diddy, there's drugs involved with that one too. And this is a fascinating topic, which we are going to be all over today. You mentioned it, Dr. David Alessi.
Pleasure to meet you.
What a pleasure to see you.
I can't hold this hand up because this is my hidden hand. They have the glove on it. Like, Cato wants me to wear this glove. I have no idea why.
No more gloves. It's 2024. There's no hidden gloves here, Dr.
Okay, fine.
It's operating hand. I got to be careful shaking.
Okay, we're going to set up Dr. Alessi's credibility here because he's been a practicing doctor here in LA for many, many years. Cedars-Sinai. Now he has his own facial institute, one of the most renowned in the country, one of the best facial plastic surgeons in the nation. And he has worked with a lot of celebrity clients over the years. So, David, great having you here.
Great being here. Thank
Fantastic.
you. And I want to apologize for being a little bit late today.
Yeah.
No, we had this problem where we don't have a problem. We had this marketing thing today. We're actually doing breast implants, 3 for the price of 2.
Wow.
And all the twins love it. You know, girlfriend. It's just been crazy today. So sorry being a little bit late.
Yeah, because in LA, if you have an A cup, you can actually park handicap. That's what I heard as an actual law. If you're that.
Why did I invite these two together to be in the same room? They hadn't met up until now for a reason, I think.
Well, no, in Beverly Hills, they have everywhere. It is for parking. Because if you go in there, it says flat rate.
Right.
$4. And
I love the flat rate. That's right. My wife is, every time she goes to OBGYN, she says she loves going there only because the doctor's handshake. What is going on with this thing? Did I just say that? I'm only kidding. She's not listening. She's the best.
He really is an acclaimed doctor, everybody. And we get this great personality too. So, no, we're going to have some fun on this one. It's not that it's a fun topic, but I think to hear from an expert about what's going on in Hollywood, do some of these celebrities have a death wish?
Yeah.
You know, and topics like this and what was in Liam Payne's system. You know, let's describe some of these drugs. We're going to talk about rehab. Can it help? All these topics are on the table today.
Yeah. Well, you were mentioning, I don't know if he's allowed to mention, Doc David, because you mentioned celebrity. I believe someone came into your emergency room, if you're allowed to talk about that, back in the day of shooting
of course,
quite
I'm
a
not
major star.
Give away any privileged information, but yeah, it was well known that Michael Jackson had burnt his hair back in 1982, whenever it was.
Yeah,
for the Pepsi commercial.
1984, exactly.
Yeah, it was the Pepsi commercial, right, that they were filming.
The Pepsi commercial, yeah. So it's he was came in the emergency room. I was the resident doctor on call, and it was kind of surrealistic to see him there.
Yeah, because that was when he was huge. That was Thriller. I mean, that was big. But, you know, people don't understand, when you're in this line of work here, it's not uncommon to work with celebrities. Even your clinic in the heart of Beverly Hills, I mean, it's loaded in that office building, celebrity dentist, specialists of all kinds. So give us an idea of what kind of people roll through the clinic there and through the offices.
It's a company town. And so when I was in Detroit, where I went to medical school, everybody was involved in the auto industry. So in Beverly Hills, everybody's involved in the entertainment industry.
Right.
So it's just like normal to have a celebrity in the office like all the time.
Mm-hmm.
Well, if you're working in Wisconsin, you're just going to get a lot of dairy farmers. So you're a celebrity. Yeah, I can milk cows like you can't believe. No, but was it just going back to the Michael Jackson thing? First of all, he's in the height of popularity. You're a doc. Do you even look at him that way? You just go, I'm a professional. It doesn't matter because you just see him as a person that has a burn, correct?
You're so used to doing what you're doing. It's just a person with a burn. You don't even think about it. But some of the things that was remarkable about it is that when they when they transfer him to a different hospital, because at the time Cedars did not have they still don't have a burn center, and so they transferred him to another hospital where his other doctor was. They opened the bays to put him in an ambulance and take him over there. And there's probably about maybe 5,000 people already in the emergency room bay, just sitting there screaming, "Michael, Michael, Michael!" It was like the craziest thing.
What and this is before the internet. This is before social media.
I
So
have no
somehow
idea how
word got out.
Yeah, it got out so quickly.
What about his handlers? Are they freaking out because that's their meal ticket?
Well, I didn't see the handlers per se, but the funny thing is when I after I'd seen him and then went out and talked to his family, it was Mrs. Jackson. So I talked to her, and with Mrs. Jackson was Don King. I have no idea how he got there, but Don King and then LaToya was there too.
Maybe Don King was going to give him a hair transplant if he needed to.
I have no idea.
That's an incredible. And I think the burn center was the same one that Jay Leno, a celebrity, he burned himself too. So I don't know what burn center, but I think he got whatever the main burn center is, because Leno had that I believe an engine, the radiator or something that
exactly.
and he
Something
got a
exploded
pretty
from the
bad.
car,
Yeah. So
I think that was UCLA, if I'm not mistaken. I think the one that was Michael Jackson went to that was in the news was Brotman.
okay.
Okay.
I'm not even sure if they have one still, but they went to Brotman at the time.
Dr. Leslie, you take an oath when you're a doctor. Everybody is the same, right? There's no more special person. You have to give the same care. Is there any added pressure when you're working on somebody like Michael Jackson? You think, oh my God, if I screw up, the whole world's going to know about it, or he's got to get out there and perform at the Super Bowl. Do you feel any extra nerves, or is it just another patient?
No, never even think about it. It's just another patient, because you want everything to be standardized. And so it's when you start treating people specially, you might give like a celebrity a little bit more time. But when you start treating them especially from a medical standpoint, it's just how you get problems. And so you never do that.
Right.
To that point, it sounds like it's a fake story, but this is true from 2 months ago. So I had my endoscopy and colonoscopy, and I'm in there, and they do a little bit of drugging you up a bit, and I'm laying on my side. This is not made up. And as soon as I'm laying on my side, the doctor walks in. He talked to me before I got the somewhat of the drugs in my IV, and he said, in the room waiting to do it, he goes, "You look a lot like that Cato guy from the OJ trial." I said, doctor, no, I am that guy. And he goes, "Well, I've never done this with a celebrity." He goes, "Celebrity." I said, "Please, just do me a favor. I'm just a regular person. Make sure you do everything right." And the next thing I know, I was out waking up in recovery.
It's fine.
You know, it's funny.
That's the truth.
I believe it.
Because
Because
I wanted just to be like I'm the one guy that
you know,
died
like
from
the Dan Patrick Show, right? One of the biggest sports radio shows there is, and Dan Patrick, the legend from ESPN and NBC. So he just had his shoulder operated on again. And I've known Dan, met him 35 years ago for the first time, and then our paths crossed a lot, just covering sports and whatnot. I was going to ask him, I was going to like reach out to him. Do you think doctors say, yeah, you need another surgery just so he can come in again, and doctors can maybe have him sign the MRI or something? I bet there are some doctors out there like that. You're used to it, right? This is LA, this is Beverly Hills. You see it every day. But I could see some doctors maybe getting a little starstruck in smaller towns or something like that, or maybe not.
Well, you see it a little bit, but I mean, you see an awful lot of doctors who will have like pictures of all the celebrities they've seen up in their office and things like that. But I don't do that at all. But yeah.
Okay. You ready for me to blow you away with some names?
Yeah.
Okay.
Sure.
Check this out. I'm going to list names of celebrities that have died because of drug overdoses. Okay. And everybody in their mind's probably thinking, I could think of 3 or 4 or 5 or 8 or whatever. But just listen to this list: Anna Nicole Smith, John Belushi, Elvis Presley, Jim Morrison, Philip Seymour Hoffman, Chris Farley, Michael Jackson, Whitney Houston, Marilyn Monroe, Prince, Janis Joplin, River Phoenix, Judy Garland, Jimi Hendrix, Tom Petty, Joan Rivers, Amy Winehouse, Heath Ledger, Kurt Cobain, Howard Hughes, Bruce Lee, and Billie Holiday. And that's just a partial list. Those are iconic names in music and entertainment and business. It's unbelievable. Now, not all of them were drug induced where they took the drugs and overdosed.
Right,
and
Joan Rivers.
Right, Joan Rivers. And some of these are really, really unfortunate. Prince, fentanyl, even Michael Jackson, how he died too. But man, when you're in the trenches like you are, right here, how common are drugs involved? Not so much maybe in your treatments because you're a facial plastic surgeon, but just when you talk to other doctors, how often are they dealing with things that have something to do with drugs?
Well, you see it all the time. And just in my office, you'll have almost probably half the patients come in and they'll have holes in their nose from cocaine. So it's extremely common. And some of the most like demure, like housewives will come in and they'll have a huge hole there. Say, where did that come in? Like I got this one story of a nurse. She was 32 years old, and she was like probably 20 weeks pregnant. She came in because her nose was stuffy. So I looked inside. I see this little gray thing inside their nose that looked like a polyp. I looked a little closer, and things pulsating. It turned out she had done so much cocaine during her pregnancy that she wrote the entire top of her brain. There was actually brain hanging down inside her nose.
Are you serious?
Absolutely. So you see coke, I mean, that's just a nurse, but not Hollywood per se. But no, you see so many celebrities who come in who have cocaine injuries and things like that. It's really, really common.
And I can't even imagine how harmful that would be for a baby, right? That you're about to give birth to, right? Not exactly ideal.
Well, and so that's because the drug will burn a hole?
Yeah, burn a hole. Just like it can burn a hole in your septum, it can burn a hole any other part of inside the whole nasal cavity. Sure.
And she survived this?
She survived, yeah. She went in.
Do you tell her, is it part of your responsibility? Like, you can identify what that looks like. You've seen it before many and many times. Yeah. Do you advise her? Can you ask her, hey, are you doing a lot of coke? Hey, I would suggest maybe you lay off the coke. Can you say something like that?
Oh, well, I say this is a cocaine injury. And, of course, you ask her if she wants to go to counseling or any rehab or anything after that. How
much coke do you think you would have to take over a period of time for where your brain is seeping into your nasal cavity?
It's patient specific, because some people have done tons of coke and they don't have any injuries at all. Other people have done just a little bit and they get injuries, but still it has to be a significant amount of coke that you do.
And can you imagine the cost of that?
Oh, crazy.
I mean, that's hundreds of dollars a day, probably.
Yeah. Do you think a lot of the addiction, like Tom mentioned, Dan Patrick getting a shoulder injury, and of course after that there's prescribed medications like the Vicodins or Percocets. Now athletes always talk about that they would take pills probably before a game or after game, and they would probably get used to the drug, but that drug is actually killing them, right? And doesn't that cause a person to go to rehab, right?
Well, it is. And again, as a surgeon, you want to basically you're very familiar with how much drug someone should have after surgery. You just give them the amount they need, and if they need more than that, you send them to a pain specialist. Because there are people who do work with addiction and are good with that. Because you don't want to be the doctor responsible for getting someone addicted. But if someone is prone to addiction, and you give them narcotics, then it will go ahead and cause they can get addicted to that. And like with celebrities. It's a problem with celebrities that they just have. If you're an addict, you're an addict, and so you give anyone at this table here a drug, and we're not going to get addicted. But when you're an addict, the way I look at it. I'm a surgeon, so I make everything simple. Is that they're missing a coping mechanism, and so if someone doesn't have a kidney, they need dialysis. Someone doesn't have a pancreas, they need insulin. If someone doesn't have a coping mechanism, they need either drugs to fill that little mechanism in, or they need rehab. And so that's why you can sniff it out really easily. But if someone has that addiction personality,
did you say sniff it out?
Yeah, exactly.
Okay.
Actually, one of my celebrities came in, and they said, I really, really hated cocaine. I just love the smell of it.
Oh yeah.
Couldn't stop them, huh? Did you finish your point?
The point is that celebrities just have a little bit better access to that because people want to make them happy. So the doctor's a little bit more willing to prescribe them drugs, which is a error.
Sure, and then their handlers, whoever's around them is going to do everything to keep them happy too, right? So they've got their hookups, and that's the Matthew Perry case a little bit, which we'll talk about too. Pink cocaine, that's a substance that kind of hit the coasts. I'd say the East Coast and the West Coast earlier this year. You hear about it. That was in Liam Payne's system when they did the toxicology report in Buenos Aires. Have you heard about this? Like, do doctors talk and say, hey, there's this new thing that's out there, keep an eye out for it? Or is there some sort of communication, or is that maybe with other friends of yours in the medical profession?
Well, as a doctor, you want to kind of keep up with all the latest stuff, both that stuff that's in the medical literature as well as stuff that's in the lay press. And so, most doctors are going to be familiar with that, look it up and figure out what that might be. But it's kind of funny where pink cocaine may not even be cocaine. And so I'm not sure if you know this or not, but most illegal drugs don't have a really strong pharmacopoeia or a strong pharmaceutical industry following them afterwards. It's not like really quality control.
So you're saying they're not FDA approved?
Okay. Pink cocaine sounds like something that they did in the Barbie movie, like pink cocaine.
But if FDA is friggin' drug assholes, then maybe. But other than that, no, they're not the usual FDA.
So I was researching that the pink cocaine and on another show they were talking about with a host of doctors on there, and one doctor said there's not pink cocaine. It's actually methamphetamine that could make the cocaine pink.
Well, no, typically methamphetamine is going to be white, but they put food coloring in it just to kind of make it a little. It's marketing. I mean, most drug dealers are actually pretty good marketers. They're pretty good business people. They keep records and books and things like that. So they make it pink. It has a great name to it. But it could have methamphetamine in it. It could have mollies in it. It could have caffeine in it. Almost always will have a little bit of fentanyl in it.
Yeah.
It's just crazy.
Well, I also heard
and it has a lot of ketamine too.
ketamine is definitely in that. And that's another drug. That's a trendy drug right now. And that's associated, isn't that like a horse tranquilizer? Isn't that what its initial use was for?
No, that would be for trank. So trank is a horse tranquilizer that comes over as trank. And so ketamine has been around. Ketamine was actually discovered at my medical school.
What is it?
It was like 1962. They were looking Upjohn, which was a big pharmaceutical house at the time, looking for a better anesthetic, and they developed ketamine, which is a great drug. It's a great anesthetic. But the problem is it's now obviously misused. But it's called a dissociative drug. So it's different than a tranquilizer. A trank, you just give it to a horse and they're completely out. You give ketamine, they can still be awake, they're still breathing, they can still talk. They just depend on how much you give it. But it basically separates reality from your brain from reality. And so that's why people think they're tripping on it. You're going to be cutting on somebody and they realize they're being cut on, but they have no association with them having pain.
So that's actually used then.
Oh yeah, ketamine's it's a great anesthetic. In like the 70s and the 80s, it was like probably one of the most popular short anesthetics for kids.
Would ketamine be used if someone having a knee surgery? They can watch it being done.
Typically for shorter surgeries, but for instead of a knee surgery, like maybe draining like a knee abscess, and that takes like 5 minutes to do. Ketamine would actually be a really good drug for that.
And then. Would it wear off right away for the person?
Yeah, it wears off right away. Yeah.
Okay. Yeah.
I know. You got to stay on top of it because some of these drugs, they're always looking for that next evolution, right? Even in the abusers of it, right? Because at one point, a certain drug isn't going to have the effect on them anymore. Right. So they're always reaching and searching and finding that next high.
But that's society in general, too.
Yeah.
It's like 20 or 40 years ago, we had 3 TV channels. We were happy. Now we need to have like 500 TV channels. We're just more and more, more and more stimulus. So it's just happened to everybody, just society.
One of the great tragedies, I think, is the fact that the opioid crisis is as severe as it is, and nobody talks about it. And with the amount of deaths it causes every single year, it's unbelievable. When you literally think about how horrible it is, how many lives and families it ruins, and then the fact that certain presidential candidates don't even talk about it, right? And what's your experience with that? Because I've noticed that people that maybe have a surgical procedure of some sort, they're going to try to avoid it, right? They're going to try to avoid oxy and things like that because it is so powerful. I used to know a person that was so addicted to oxy that she would buy from the streets, right? By the tablet if she could. I mean, she couldn't function almost without it. And it's I feel so bad for those people because they start, they're prescribed it, you take it, you want to get rid of the pain, it works, and you can't let it go.
No, it's so addicting. I even had a celebrity one time, and they were in the office, and they said, "Doc, can you please write me a prescription for oxy?" I said, "Are you having pain?" "No, but please do it." I said, "I can't do that." And they get on their knees, they come over, grab my hand, they say, "Please, doctor, I will do anything right now if you give me that prescription." I've said, "I'm sorry, I can't do that. Get back in your chair."
Wow.
And that's a true story, right?
Yep.
And
it's a true story.
You can't name names, obviously, but
okay, who don't mind if I mentioned it?
I am so anti-drug. People back in the day, I was like, first of all, I only like having control of my body by myself. I just have a glass of wine and I think I get an immediate migraine. So I think it's a blessing that I have that. I'm always aware of my senses. When you were talking, Tom, about fentanyl, the crisis that's going on, how do you know anybody, I read about these kids that for the first time maybe take a drug if it was laced with fentanyl without them knowing they die. So is someone like taking the drug and I don't know how it works. Is it laced in there? And
I think you need to lace it in there. Remember, fentanyl is such a powerful drug that just like a tiny little, like a needlehead of fentanyl on this table is going to have to kill all of us. And so if they're sitting there, you have a big cutting table and they're trying to make spike their drugs up. Maybe they're trying to make pink cocaine, so they're adding a little fentanyl in it so they can bring them down. They add a little amphetamine in to bring them up, and they bring the ketamine along with it. Again, they're not really quality control. And so they're mixing it up, but they don't mix it up enough. You're not going to have equal distribution. So some will get some with a very little drug in it. The other one will get a ton of the fentanyl in it. And also they take that one pill, and all of a sudden they're dead.
They're dead, just like that.
So
that's Prince, right?
And it's a pill, or is it a?
Well, they can use it. They put it into pills.
Yeah, it's
they press pills and they make it, right? They use it.
Yeah, to crystal. And so, but then they mix it with a starch to make it into a pill. But you can inject it. You can do different forms of it. But it's like it's a crystal.
Yeah, Cato, it's interesting because people that are following this show and really get to know you, they see who you really are. But in the 90s, like after the trial, do you think there was a perception that you were some druggie or something with the hair? And
there was a thing on Current Affair lasted for months, and it destroyed my life and my mom, my family, of a guy saying that I was the dealer that met the story that came out. I was doing dealing the drugs at Burger King and all this. So I kept saying to the lawyer, I said, find this guy. I want to have him go on. I want to defend myself. And so it was years later that someone had said it was just all made up.
Yeah.
And
and then once that story starts, then it spreads,
exactly.
right? People
And
have
it
that
was-
perception.
It was devastating because I live really pretty clean life.
Yeah.
I always tell people, even in high school and college, everything, it was like everybody's drinking and drugs, and I was like, I'm already there. I don't need it. So it's that one of those.
Kato's high on life.
Yeah.
yeah, for sure. Every now and then you hear about a truck that's driving through Arizona or Texas and it gets pulled over with 80,000 fentanyl tablets.
Oh, just crazy.
And then you're going, how much are they missing? If they're catching a random truck every once in a while that has 400 pounds of fentanyl, how much is actually getting through? The amount of drugs that are processed and created and either made in Mexico or China or end up over here or done here, I think we'd be blown away, right? I mean, just at the volume.
And again, the borders, as you know, is pretty porous nowadays, and so there's really just no control over it. And they can get it, and it's such a, it's the amount of fentanyl you need to be able to distribute is just so small. That's just you can just carry it on a plane. It's so easy to do.
Yeah, you can get that through TSA. I mean, they're not going to see it. Or
when you say that just a pinhead of it can kill everybody in this room. So if there's a truckload of it, I mean, that could kill the United States.
Oh, it would just be incredible. Yeah.
And that's my point too. Like with Kamala Harris, I mean, who's in charge of the border, right? And the results of having an open border. And one of the biggest problems is the drugs that are getting through. And to not care about that, you almost have no conscience.
It's actually so particularly egregious because she claims to be the spokesperson for Black rights, and the fentanyl epidemic has hit the Black community especially hard. And so if you think about people who are coming over the border, taking jobs from all our communities, Black community, brown communities, white communities, but then also having a community that's particularly affected by drugs, it's just a horrible thing. And then you have the opposite, where you have a president whose brother died from addiction, and so it's just something he's absolutely passionate about. Just besides the fact that it's ruined the economy, but he's so passionate about drug addiction and stopping the fentanyl crisis. It's just like two stories that are just twisted.
Yeah.
Yeah. Well, and also I think with speaking not just of drugs, but RFK with being how many vaccines are needed. There's 62 when a baby's born. Am I right?
Yes.
Isn't that 62 vaccines? I mean, I don't know what your views are. Do we need 62 vaccines when you're a newborn? I mean, I would think you get
some of that needs to be restarted. I think the whole it's actually means there are some vaccines that have been around since Jenner's time. Since smallpox and cows and all that kind of stuff for a long time ago, a couple centuries. But some of the newer vaccines, they really haven't had enough studies to know exactly what's going to happen with them. And so the RNA vaccines, I still think the full story on them is completely out because you have to wait a full 10, 20 years to really see what the final effect's going to be. So like some of the classic vaccines are probably safe. I mean, polio vaccine has been shown to save a lot of kids from getting polio, et cetera. But I think the full story it's yet to be determined.
Yeah. I'm in my early 30s, but I want to get that shingles shot when I'm old enough to do it. Right? I want to get the shingles. I don't want shingles.
No,
and you can just go to Walgreens and get that.
It's a standard shot, a standard vaccine therapy. It's been around for a long, long time, and you do not want to have a post-herpetic neuralgia, or basically the persistent pain the rest of your life from shingles. Because I've seen
Jesus,
people
now you guys are scaring me.
No, let's get the shingle shot. I'm actually a little older than my
55,
early
so
30s.
I have to get it, huh?
I would probably get the shingle shot. Yeah.
Yeah, I'm going to do it.
That's one thing you don't want to get.
Yeah.
And again, the RNA vaccines, again, they're probably safe in a lot of regards. They probably kept a lot of people out of the hospitals, but they probably have things that we're not entirely sure about, and we're just discovering some things about that. And it's arguable whether or not natural immunity is going to be better than that from the vaccines. The Mayo Clinic or the Cleveland Clinic studies suggest that it probably is. But be that as it may, standard vaccines they've been around for a long time, and they're really, other than there's small amounts like Guillain-Barré, like all these different things, but they're very, very low. And the benefit so far outweighs any complications. So I get the shingles vaccine.
Yeah. Well, David, I know you're a huge Harry Styles fan. You love One Direction, but it really is tragic about Liam Payne, right?
Harry who?
Harry Styles,
Oh, yeah.
right? So Liam Payne. Now, clearly, this guy has a lot of demons running around in his head, or did. Depending on who you talk to, he had a 7-year-old son, right? So that young boy's going to grow up without a father. He had fans, millions of fans, really a talented guy. Simon Cowell discovered him. He's still devastated by it. He talked about suicide a lot, Liam Payne. You talk to the people around him, these stories are out there, that Liam Payne talked about suicide frequently. Is there something real to having a death wish? I think of Chris Farley too. Remember, he idolized John Belushi and almost went down that exact same path where they almost think it's inevitable. It's their destiny. Is there truth to that?
Yeah, and all you experts in addiction out there, don't quote me on any of this. But yeah, there's I have a lot of experience with addiction patients. I even have family members. I've been to Al-Anon before. And I'm probably going to bastardize the whole thing. But one of the philosophies in Al-Anon is that the person who's truly addicted basically a lot of them have mental disease, bipolar, depression, whatever it might be, and they have demons or the lack of a coping mechanism, and so they pretty much have a death wish, and so they're trying to kill themselves slowly. But the problem with addicts is that they want to bring everybody down around with them, and so that's why they suggest you go to Al-Anon to basically realize that the patient is on this journey to death unless they get help. And they want to bring everybody with them along, and so that's why you have to be really careful with that. But it's really true. You watch an addict, and they just basically just want to kill themselves by a bunch of multiple small cuts, and then they want to have everybody in the whole world see them do it, and that's why it's such a tragic disease, not only for the addict but also for everybody around them.
Yeah. The article came out that it was a suicide, according to what I read today on Liam Payne jumping off the 3 floors.
Maybe,
was
arguably it could have been he could have been if he had a pink cocaine. He could. They even sometimes put some what's the Sasha hallucinogenic, not LSD, but the other one that came out in the 70s. But anyways, something that had some of this hallucinogenics in it. It had the ketamine. And he could have just been tripping. He could have just he could have thought, well, I can fly, and and he can't.
Right.
No, that's my theory too. They found whiskey, a cigarette lighter, crack, cocaine, pink cocaine. All those things were in his room. The room was kind of messed up. The TV was smashed. You're on that 3rd floor. You have the sliding door open. You're falling. You're dancing around. You stumble over something. You have no control of your senses whatsoever. Yeah. I don't think he jumped. I don't think somebody could.
Yeah, my disclaimer was it wasn't a suicide. I think maybe what you're saying, it could have been so much in the system that maybe, I've heard about this thing, so people think they can fly, and they can't.
Remember that show?
I know, Spirit.
Lethal Weapon.
1,000 Ways to Die.
I actually do. Yeah, now it's coming back.
It's a funny show, but they basically
show. Yeah.
But each week they show a few different scenes that interesting way people die. They have this one scene about this guy who was out in the Palmdale Desert, and he was tripping on LSD and some other hallucinogenics, and he came across a group of furriers.
What's a furrier?
A furrier is people who dress up in furry costumes and have sex.
Oh.
Okay, so there's the whole group all having sex and things like that. So he said, I'm going to get involved in this thing. So he goes, gets strips naked, goes up and he grabs one of the women dressed like a bear, and he goes after it. But it turned out to be a real bear. That's a true story.
Oh my God. Right?
Did not end well. The bear was probably happy, but not for the.
Are they still together? And where are they registered?
Okay, that's crazy.
That is
it just shows when you're whacked out and you're under the influence of whatever it is to that level, man, you're making some bad decisions.
Yeah. And again, if it was during the 1920s when the whole Me Too movement came out, they're probably going to the title of No Means No.
Matthew Perry was the other big story this year as far as a celebrity dying because of drugs, essentially. And the difference with this one, though, is people are being held accountable, right? The people that supplied the drugs, that wrote the prescriptions, there's doctors that have pled guilty, maybe doing some jail time. I mean, that's an eye-opener, I would imagine, on a lot of levels for some of these doctors out there that are supplying drugs and writing the extra prescriptions. I mean, there's a price to pay.
It's a great thing, and it's and a little bit from a cynical opinion, but just overall, I mean, if you're a dealer and your client dies from their drugs, you're going to be hopefully you're going to get out of the business. But even from a cynical standpoint, there's no quality control. And seriously, if you're a dealer now, I think you'd be a little bit more serious and a little bit more careful about how you're getting your drugs. And you can do it much better. You're not going to just sit there and just mix it together and give it to somebody. Hopefully, there'll be some quality control, as they said, cynical in drug distribution or drug the drug trade. But But hopefully, a lot of people are going to get out of the trade altogether.
Yeah.
You know, Tommy, you mentioned Matthew Perry. I think you tell me that he was 18 times in rehab, right?
Yeah, 18 times. You know, it's interesting because, you know, in the stories that came out after he died, when you watch Friends, if he's super skinny, he was on drugs. If he looked thicker and bloated, it's because he was drinking a lot. You could literally see that in the episodes.
Yeah.
And he was pretty much troubled a good part of that. He says it goes back to this, I think, water skiing or jet skiing accident like in the 90s where a doctor prescribed him Vicodin. And boom, runaway freight train from that point on. 18 times in rehab. He spent millions.
So I have a theory on that. I mean, I just had recently someone that I know reached out to me from out of the blue over 20 years ago, came to LA. He's in a rehab. He said, I really need support. Would you ever come and visit me at this facility? Well, it was a mansion, basically. So I went there, and the dinner was lobster, and this home was just drop dead gorgeous. And he was more alcohol related, and he was on, when I was there, he was on his 12th day, and he was clean. He looked totally different from the pictures he showed me, the cleanup. But the trouble that I have is you're paying like $50,000 a month, and you're in a mansion, and it's not a real life. Everything's catered. There's a health club. There's massages you want. It's all inclusive. And I'm thinking that I believe it's 95% of the people go into a relapse. Do you think, my opinion, do you think it's because it's sort of rehab, by the way, is a great thing, but do you think it's because they're in a facility for 30 days where it's not, where you're catered to, and it's probably easier to get off something, but when you go back into the world, you have relapse? Do you?
Well, again, it's there's controversy as to whether or not those acute care rehab facilities are going to be helpful, but having so many patients with it and having experiences with it, it's very, very rare that, first of all, it's impossible that someone will go to rehab one time and be cured. It just ain't going to happen, okay? Right. It's a lifelong thing. And getting back to my analogy about how if someone doesn't have a kidney, they need dialysis. Someone doesn't have a pancreas, they need insulin. If someone doesn't have a coping mechanism, they need to have AA. And so the rehab facility, whether it's luxurious or stark, or whatever it might be, is not a bad way to go for some people. But no one has ever, in my opinion, very few have ever really succeeded unless they're actually in AA, because they need to have that coping mechanism filtered several times a week. And if it doesn't happen, they're just going to relapse, because the only way they can cope is to do drugs. And so they say, well, my problems are bigger than yours, or bigger than yours. But that's not true. We all have issues. But what makes someone who has an issue drink, and you have an issue and just cope with it? It's got a coping mechanism. And so if you don't go to AA all the time for that filter, or the dialysis for your brain, you're going to relapse. And so that's why it's so important. And I have seen some of these facilities who don't sit there and emphasize the follow-up care for long-term afterwards, especially with AA, because they want to do it a unique way. And the only thing that vast majority of patients who are successful with sobriety are people in AA. And AA is kind of a cool thing in LA, because there's such a plethora of people. I mean, half the Hollywood industry, I don't know if that number is accurate, but it seems like a lot of people in the Hollywood industry are in AA. It's almost like this club. You talk to them and they will go, well, I'll give you, you're in AA. I know this guy from AA. I'll give you a job here. Or I'll give this guy a job here, and things like that.
Right. So,
in fact, if I understand correctly, the guy who, one of the guys who was involved with Jurassic Park met a dinosaur in AA. Okay. Okay, fine.
but by the way, I think rehabs are great. I wasn't saying it's a thing that doesn't work. But yeah, my point was that I agree with you. And even at my place, I redecorated my bar. I just put new drunks around it. I did one for Tom.
Yeah, the Soho House and AA, they're right there for networking here in LA, right? I mean, they're exchanging scripts, getting deals made.
We're riding horses in Malibu, and that's going to lead to long-time sobriety. I mean, I said, I'm not here to argue whether or not they're good or not, because sometimes I think we always think it's a joke, and they have movies about it that show how much a joke they are. But I mean, if it gets someone started on the road to AA and sobriety, then I'm in favor of it.
Yes.
You know, so many celebrities do have addiction issues. Do you think it's a personality thing? Like, can somebody do a lot of drugs and drink a whole hell of a lot on a nightly basis, frequently, socially, at home, whatever, and not be an addict? How do you cross that threshold where you're officially described as an addict?
Well, again, you have to go back and look at the statistics, and I'm not familiar with all the statistics, so we're just going to make some general assumptions here. So, it's a certain number of people, if you give them enough drugs and alcohol and things like that, they will become addicted. I mean, there are some things that you get addicted to no matter if you have addictive personality or not. But there are some things, if you go ahead and give them enough, they'll happen. Also, anyone who's in front of a camera all the time, you have to be a little bit of a narcissist, because you have to be able to go out there and say, I can do this better than anybody. No offense,
you're blocking my shot.
So no, my mouth a little bit dry. I need to have a little bit of this fake aloe plant to go ahead. Much better. Thank you. Okay, good. And so I think if you're a narcissist, it basically a lot of addicts are narcissists, because again, remember, if you're a lot of addicts basically want to commit suicide, but instead of doing it by themselves, like I hate to say a normal person, but like the vast majority of suicidal people, they want to take everybody down with them. And I think you have to be a narcissist to want to take everybody down with you, that your loved ones and everybody with you, to go down the same rabbit hole and kill yourself.
You're right. Where it's still all about you.
Exactly.
Yeah. And also I think it's like famous fleeting, and I don't know Liam Payne's situation, but Harry Styles became the big star, and I'm just wondering if that plays a part of it too, because when you're not in the limelight anymore, it's
right, because you're equal when it's 5 of you, right? When it's a boy band out there and everybody's screaming at you, but then when you break off, one guy's a megastar. You know, he was good. I mean, he was selling. He's selling a hell of a lot more. You know, that always happens when somebody dies. The sales go up. Like his Spotify streaming has doubled.
Yeah, but the whole thing is, when you're not at the same level like the Harry Styles, as why is he getting it? When this Liam Payne guy is still very successful, but I don't think they can program that in their head. And then not
in the limelight. Like what happened to me is, like when I'm in the surgery, I'm in the limelight all the time. And so I go home and I'm starting to do some butt implants on Debbie's dog, my beautiful girlfriend, and she stopped me. She took away my alcohol. Okay, damn it!
You did a butt implant on a dog?
Only got one because she caught me.
Back when my dad was living, he got the baboon heart transplant, and it worked. That actually worked, but he got a really pink butt. So
you pick that all the time.
All the time. So where are we going with this? I love that.
I would imagine you have to almost have a sense of humor or have it developed when you're in medical school, right? Because it's a grind. It's nonstop. It's years and years, right?
It's yes and no. I mean, you have some doctors that are deadly serious, but then other doctors that have humor. And I've been taught by a long time for a lot of patients that are this humor is good. I have this this one patient, a guy named Robert. And he had right back in the heyday of AIDS, like in the late 80s, early 90s, he's in the hospital and he's dying from AIDS. I go in there and he had this book open. He's reading a book about Sarah Ferguson, who's kind of a homely woman in my opinion. But on the back cover, it had her in a negligee, lingerie. And she looked kind of cute. And I said, I never knew that Princess Sarah could look so good. And the guy goes, if I was straight, I probably would want to date her. But since I'm not, just going to go home and dress like her. And the next day he was dead. And so it's like if I'm going to die, I want to go out laughing too. And so it kind of teaches you a lot when you have patients who actually have a sense of humor. And if you can, you have to be careful how you do that. But but if patients are up for a sense of humor, you can tell, and they kind of help to assuage some of their fears.
Yeah, it's the laughter is the best medicine. Your bedside manner manners, and
absolutely.
And was it Norman Rockwell? He said that he had terminal cancer, and he said, "I just want to watch Marx Brothers movies," and the cancer went away. That's that story. I think it was Rockwell.
Well, it's like a coping mechanism that's not going to kill you, right? Exactly. Laughter or making light of a moment, which you have to do sometimes. With Rockwell,
but it was some famous.
There was another interesting thing from Liam Payne in Buenos Aires, Argentina, when he died, which was not long ago. And within days, they had the toxicology report from the autopsy. Whenever somebody dies of an overdose or things like that, especially a celebrity, it seems like it takes a long time. Weeks, 2-3 weeks before you get the toxicology report. It's almost like you have to go to this higher authority that can only determine this data. This came out in a couple days. Do you think part of that is Argentinian authorities maybe wanting to move this on, or has there been advancements where toxicology reports can happen a lot quicker?
Well, no, you can toxicology like right away. If someone gets them into the ER, you draw their blood, you can find out within 2 hours what kind of drugs they have in their system. So they're able to do that like immediately. I think maybe it might be jurisdictional related, like in the United States, they want to basically have the coroner go over all the data and prepare a thorough report and things like that before they release it. They don't give like partial information. So maybe it might just be the way it's done in a cultural in Argentina, or it could have just been a one-off, and it just because they're such a celebrity. But yeah, I can't really say.
What's it like when you're dealing with a celebrity client? Do they become pretty vulnerable? Because so much in their life they can control, right? Or they have control over, Absolutely. Or they want to. They come in there and they got an issue and they need surgery or they need their life saved, it's all on you.
It's very rare that you're gonna have a jerk in your office. Okay, he's a celebrity, because they don't even come in. There's one celebrity come in, and he had he pictured himself. He signed these pictures and given as he's walking, he just give them to all the staff, just assuming they want to have these pictures of this guy. But as soon as he gets into the office, he's just like a normal person, and they basically. With psychiatry for sure, but even with just a regular doctor, there's this process of transference where they come in and they will transfer their. You'll often become their father figure, and you'll take care of them. It helps in the whole healer transition, and so they do. Most of them become very, very vulnerable, and they listen to what you say. You can talk to them and whatnot.
Mm-hmm. What's your take when the big pharma companies were being held accountable for the opioids, right? And civil lawsuits, or the government was cracking down on them. How much pressure is there on doctors when sales reps come in to try to push a certain drug or a device or something like that?
There might be. It's not as much as it used to be in the old days, especially for narcotics. I mean, but a lot of it is you can fall in the fallacy of the doctor. You're so busy that sometimes you get some of your medical education from a reps, which is probably what you don't want to do. If someone tells you something, it's up to you to go ahead and research it to make sure that the information is accurate. They can be of use sometimes. There may be a new drug that just came out that you have no knowledge of what it is, or you hadn't read about it in the medical literature. Also, you read about, oh yeah, this stuff is really good. It does all these actions. I wasn't aware of that. Yes, I'll go ahead and prescribe that. But it's I don't think that nowadays many doctors get too influenced by the drug reps.
It's so funny because when you have drugs being tested for something else, they always find that the drug works for something else. Like Pfizer finding out that I think it was a heart medication actually became Viagra.
Yeah,
and
exactly.
Which Tom, by the way, takes to keep him from rolling out of bed. But seriously,
that's why I keep from dribbling on my shoes in the morning. But yeah.
Awesome. So with the Pfizer. What do you think of the Pfizer not being able to be sued, or any of the pharmaceutical companies couldn't be sued when they were doing the COVID vaccine? Doesn't that smell scam right there? That they can't. That they going in, it probably could harm you.
It kind of makes you scratch your head a little bit, because the exclusions they got for not being sued is just blanket. And so if they had fake data in there, my understanding is that if they had presented data and they misinterpret the data, or purposely misinterpret it, they still couldn't have any consequences from it.
They could not.
Correct.
Correct.
That's my understanding.
Mm-hmm. Yeah.
And so I think it's pretty egregious. I mean, it's basically they could have given some immunity, but to have blanket immunity for any and all causes of action is just ludicrous.
Right. And then finding out these young athletes getting myocarditis, it blows me away, as I follow Dr. Peter McCullough, who I don't know if you know or not, but I'm fascinated by all these studies that could come out, and I wish I was a doctor.
Yeah, and I don't have any direct knowledge of what happened, because I don't have access to the internal memos of Johnson & Johnson, but they had their vaccine came out, and my girlfriend Debbie had the vaccine, and then also she developed a subclavian clot, which is very, very rare.
What is it? What was it?
Subclavian clot, or the whole arm up here clotted. She came out with like incredible Hulk arm because of all the clot that had developed. And clots in the lower legs are very common, but a clot in the upper extremity is extremely uncommon, especially in a young, healthy person. And then my sister's best friend, who was a lawyer, had the J&J vaccine, and then 2 days later she woke up and said, "My foot feels funny." She looked down and 3 toes were black. And she had to have half her foot amputated.
Oh, yeah. Wow, that's horrible.
Well, it turned out not that bad, because she got shoes for half price afterwards. But still, I mean, who wants to lose half their foot?
Like I said about his bedside manner.
and she went to sue the company, but the evidence wouldn't stand up in court.
Where's the drum? Where's the? I need a band. I wonder what this long list of celebrities that have died because of drug overdose or some sort of addiction. When you're addicted to prescription pills or painkillers or whatnot, is there like a legitimate underground market here in LA where they can get them? Because, or do they just have doctors? Are there so many unscrupulous doctors that will just write whatever to keep these guys going?
Well, I don't think there's so many unscrupulous doctors. I mean, there are doctors who may prescribe a little bit, but they're well-known pill factories, and they dispense something like huge amounts of narcotics. And thank God a lot of them are getting caught, but they're still it's amazing like how you'll see these people who've been had like $100 million in income from their pill factory and things like that. I mean, just horribly egregious. What's happened in the past few years, they have a national reporting system. So anytime you prescribe a narcotic now, you have to go online, look it up. And so what happened before, a patient would come in and they would have like a infection or some kind of like a cut on their face, whatever it might be, some injury. They would go to one doctor and say, "Look, I have this injury," and they may even been self-induced, and they get the pain pills. And they go to another pharmacy, another doctor, and get another pain prescription. So they would sit there and get like 50 prescriptions because they're really, really aggressive with getting them. But now they can't do that anymore because every time you do a narcotic, you have to look it up online and make sure that they haven't got it from somebody else.
And what doctor wants to risk losing his license too? It's like they go to college their entire life and then they're going to be doing it on someone.
Yeah, but some of them get starstruck.
I agree that some of them give out prescriptions.
And I would imagine for some of them, money talks too, right?
Yeah,
Throwing some cash around.
I know a doctor who was involved with who used to take care of John Belushi. I don't go into too much detail, but that doctor wound up having a heart attack. I always wondered at an early age. So I always wonder if that I don't know for sure, but I always scratch my head if basically they were out doing cocaine with John Belushi.
I mean, it's a logical assumption.
Yeah.
I mean, I could see trying to connect the dots there. It makes sense. Okay, so you worked at Cedars-Sinai.
Yes.
Was that where your residency was?
I did my internship there. My residency was at UCLA.
Okay, so People Magazine, Us Weekly, TMZ, Page 6, Cedars-Sinai. That's where the celebrities go, right in Beverly Hills. What's it like there? Do they have to have special precautions or added security or a VIP room or things like that for the amount of celebrities that roll through there?
Well, first they have a very nice VIP ward up on the 8th floor. So they really, really big rooms, and they take care, and they have the VIP floor, just like Fondren 12 and at Baylor in Texas. And there are some hospitals that cater to very, very wealthy people, and so in terms of security, they actually have if someone is a celebrity, they basically had to go through several layers to be able to open up their medical chart because everything now is a medical chart online. And so it goes through several levels. But there'll be often a celebrity there, and people will be trying to get in there because they know if they can get the medical records and sell it to National Enquirer, they can get a big chunk of change.
Or TMZ.
Or whoever it might be, exactly. But then, it's really hard to do, and they all know that if they get caught, they're going to prison.
Yeah. I'm sure doctors talk, right? I mean, you have friends in the business. Any buzz or word or rumors or things or that, or doctors that have worked with any of Diddy's victims or anything like that. I mean, that scandal is, when you see the level of detail that's coming out in these civil lawsuits right now, and I love the fact that Busby, the attorney in Houston, is going all in on this. Seriously. I mean, this guy's not playing around. You know his background. He did the Travis Scott Astroworld suit for the victims of that. All the Deshaun Watson victims he is involved in. Any big story that involves celebrities in the South or in Texas, man, this guy's all over it. He was on the cover of Time magazine. Yeah. I mean, this is a legit attorney. It's just insane when you hear some of these Diddy stories and the drugs probably that were involved in this, along with baby oil and all the other drugs.
Diddy's drug was power. Other people he gave power to because he even said he doesn't want to ever hire someone with talent because they can't be controlled. And that's a power trip. But can you imagine we're going to find out what's going to happen if there's tapes or whatever of him drugging up certain people. I mean, is that where you're assuming? Or is
without a doubt. I mean, I'm sure that's what he was doing.
Well, it's in all the allegation that that drugs are involved quite a bit in terms of it's just even date rape drugs and things like that.
Which is would it be ketamine too, or no?
Ribono is common. It could be ketamine. It could be even a little bit of fentanyl. Fentanyl's so little, as long as you have to be careful. But you can put a little fentanyl in there. Someone's going to be semi-conscious, but ketamine would be a good one to give. Yeah.
Mm-hmm. Okay, you mentioned that Michael Jackson story at the beginning, treating him after he was burned, taping the commercial for Pepsi for the Super Bowl. How bad was that burn when he came in? Was it a bad injury?
I can't say.
Oh, okay.
But at least in the news, it did not say anything about him needing a skin graft or anything like that. So it couldn't have been too bad.
Or you just worked a miracle that day. We'll give you the credit. I know you can't name names and go real specific when you talk about celebrities and clients like that, but can you walk around the edges a little bit and maybe talk about it? Maybe some particular stories, or we could maybe you could tease us a little bit here.
It's just that I remember the doctor used to believe that he did a lot of addiction. And he used to believe that to get someone off drugs, you'd sit there, and if narcotics, he would sit there and give them tons and tons of narcotic, like supervised in a hospital over a few days, and all of a sudden abruptly stopped. But I don't know where that ever in the medical literature, but he's very famous for that. And some of the people that come through there, I mean, some of the famous rock and rollers and movie stars that would come through there was just incredible. Mm-hmm. There's a very famous remember being an intern taking care of a famous singer, TV celebrity and singer, and he was in there because he had done so much of his stuff that I was abusing that he perforated his appendix and no one even knew about it.
Wow.
Jeez. Because he would just be in such a cycle where he would deaden the pain with another drug, probably.
Yeah. And another famous celebrity was doing drugs, and they fell over a trash can and had some horrible fractures. Yeah.
We'll do it like the $25,000 pyramid. Tom and I will just say celebrity names, and you can say yes or no.
Okay, go ahead.
Okay.
No.
Singer Amy Winehouse.
Nothing.
Okay, we can't say it.
Yeah.
You know, it's a speed. It's a speed round. And for some celebrities, it actually is the speed round. Yeah.
You know, okay, there's a lot of people that take a lot of drugs. Are there devices out there to test something for fentanyl? Like, is there something you can buy on Amazon that you can... Have you ever heard?
But of course, you can do a lab test for fentanyl.
No, but I mean, just like a normal person.
That I don't know. A good question. If it's not, it should be done. That so you can.
I heard there was. I heard there was things you could buy on Amazon that can quickly tell you.
Well, I mean, you can take a little sample of it and run it through like standard chemistry tests and things like that. I'm not sure if there's something over the counter that the consumer can go ahead and do.
Or just find somebody you don't really like and have them taste it. And if they drop dead,
no, for all my drugs, I always have my food taster. Exactly.
What's your feeling about? You know, I watch a lot of sports, and I think something tells me you like sports. So you watch a lot of these sports shows, or actually games, and there's always a commercial for there's like a new drug. Every commercial is a different drug for depression or something else. I can't think of all the names, but you know, there's commercial after commercial for someone. It's sort of like they're addicting America. It's like, you have a problem, you should take this drug, and then they have the disclaimer of what it could cause.
Oh,
depression.
yeah, that takes 5 minutes.
They do this. Is that because someone did die from that, or is that because what are the chances of this disclaimer of 10 different things may cause depression, may cause back pain, may cause loss of hair, may cause whatever it is? Can that?
Well, that's actually not driven by litigation. It's actually driven by the FDA. So for a drug company to want to go ahead and advertise, it started a long time ago when drug companies had never advertised to the public before. But when they came up with the concept of advertising directly to the public, they went ahead and went to the FDA, and the FDA said, okay, sure, you can do this, but you have to basically be honest about what you're going to be advertising. And then you also give all the disclaimers as to what it could possibly do. So all that is actually just driven by the FDA. That's why it's there.
But do you think that it's terrible that that we're kind of pushing, kind of telling people you have a problem? I mean, it's kind of saying you have weakness, where, I mean, Tom, I don't know. I think you're don't do drugs, you're kind of high in life. The whole thing, it's like you look at these commercials and you're like, are there really that many people that
I think so that take these prescribed things for anything?
Who watches football? They're couch potatoes. And every time there's a football game, you always have an ad for Wegovy or Monroe or something like that. So,
exactly. Could be anything.
You know, so many people, their whole existence and their culture. Oh, I got this doctor appointment. Oh, I got to go to the pharmacy to pick up. I mean, it's just so part of who they are and their daily routine. I try to stay away from doctors. You know what I mean?
Yeah.
It's unbelievable. Like, a good part of America, probably. You know, and they have issues. They don't take care of themselves, and one thing leads to another.
Exactly. And if you look at demographics, if you look at some of the political ads, I don't know the demographics at all, but a lot of the demographics for political ads nowadays are actually during football games are targeted toward the African American population. And so a lot of the drugs you see are actually like weight loss drugs and things like that are actually targeted for the African American population, where the rate of diabetes and obesity is going to be a little bit higher. So it's I mean, I think the drug companies know their audience, and so and the drugs for weight loss. I mean, it's there can be side effects to them, but the benefits to weight loss drugs like the GLP-1 agonists are so overwhelmingly in favor of helping patients than it is any potential side effects. But then there are some drugs that you kind of scratch your head about.
Like Ozempic, is it safe?
Ozempic is very safe. I mean, there's like low incidence of pancreatitis, things like that. But in terms of the for any of the GLP-1 agonists, when you lose weight, or you take a little bit of weight, for someone who's obese, the average lifespan is going to be about 13 years shorter. And not only is the rate of heart attack, stroke, diabetes, sleep apnea, is lower with people who are in losing weight or on Wegovy or semaglutide, whatever it might be. But recently, the incidence of stroke, Alzheimer's, Parkinson's, arthritis all go down when people are on these drugs. And so it's It'd be better, yeah. From their standpoint, it'd be much better if people could get their asses off the couch and get motivated, and things like that. But some things just aren't going to happen.
Well,
Well,
and
I
plus
think
there's
make America healthy, and that's the whole. I think the basis of that.
well, and plus there's things in the food, we all know that makes you just crave
It's a horrible
more of
food,
it and just
exactly.
constantly eating. If you're not active, it's a slippery slope. Okay, we're gonna wrap this up in just a second. I got one quick one. You're a sports fan. We're all sports fans. You watch an NFL game a couple weeks ago. Aiden Hutchinson of the Detroit Lions.
Yeah.
Terrible injury, broken fibula and tibia. Right, you can see it.
Yeah,
right,
that's
it's horrific.
horrible,
You can see it snap. I had that injury when I was a sophomore in high school. I had the exact same thing. And it was a non-contact practice. It was the day before the first game, and I was the starting quarterback. And this guy whose nickname was Killer Knisley, tackles me from behind, snap, fibula, tibia.
Compound.
Yeah. Well, so back then, I mean, it wasn't fun, right? But the treatment for me was the coach telling me, I think it's just a sprained ankle. So I didn't go with a shock or whatever, right? Oh, yeah, you'll be back next week, and I was maybe trying to believe him. What can you do for a player on the field in an NFL game that has this horrific injury? What are there pain things that you can snap into them right away where it alleviates it? Because I feel so bad when these guys are down.
Trauma, I don't know what they use in the NFL, but typically Army medics will have ketamine and morphine.
Morphine, yeah.
If someone is writhing in pain, you give them ketamine. All of a sudden, they at a controlled dose, then they're going to be a lot. The pain will just kind of go away. They'll be a lot happier. I mean, drugs. The Michael Jackson drug, propofol, great drug. It's like a white liquid, so they call it milk of amnesia. Used every day in surgery all the time. It's a great drug. As long as it's being monitored and watched. And ketamine can be a very effective drug as long as it's being for anesthesia, as long as it's being watched and monitored.
Well, in the wartime, they always had the morphine for the
Right.
guy.
Yeah,
Saving Private Ryan, immediately they go into their leg.
Yeah,
to
so
stop
boom, just gets right into your system.
I broke, not comparing to yours, but I did the Dave Dravecki by throwing a curveball compound, broke my humerus bone. It's like after throwing so many curveballs, the muscle can wrap around the humerus, and it cracked in half, and I was in pain. Same thing. It's like, it's not a break. My arm was in a position you can only do if it's broken.
Oh my God, I've never really heard of that, of breaking a bone from overthrowing.
Then, as you know, as a doctor, every finger looked like it was a potato. The blood couldn't go through.
It's just crazy. Yeah.
It was. Anyway,
Don't you have a good Tommy John story?
I'm friends with him.
Yeah, Tommy John. You're friends with Tommy John, right?
Yeah.
No, the fact that you're friends is probably the story that I remember.
Baseball,
Yeah. By the way, he's probably going to go into the Hall of Fame, and he deserves it.
Yeah.
Have you looked at his numbers?
Oh, his
how many
numbers.
complete games, or how many one-run losses that he's had? He could have like 320
I had no
wins.
idea he wasn't in. I just assumed he was.
I don't think he's
everybody
in.
does. Yeah, everybody thought he was. His original Tommy John cast is in the Smithsonian.
Oh, crazy!
It is,
because I was invited to go there to see the signing, and it's in the Smithsonian.
Yeah, no, that's cool.
So yeah, Tommy will get in there.
Anything else about celebrities, medicine, doctors,
we got so
scandals?
many stories we tell you. It's amazing.
Yeah. All right. Well, look, this was a great topic. This was awesome. Are you squirmy?
And there was humor in it.
There was.
Not from you.
No,
from
no,
Tom.
no.
Oh yeah,
You
I'm
and
cracking
Debbie.
everybody up
Debbie
over here.
had the
No
best
doubt about
jokes
it.
there. Yeah.
Hey, are you squirmy when it comes to blood and seeing things like in an operating room? Can you look at that stuff?
I can look at it, but I can't give blood. I give blood. I not so much I pass out, but I immediately have the sweat. And I get completely wet.
Reaction. You pass out basically. If you're standing up, you pass out.
Yeah.
So you have to give blood laying down.
Yeah.
I mean,
I don't know. What is it?
It's called a vasovagal reaction. Like when I was in a residency, my professor, I did research for a year, and so my professor was my proctor for the research. And so every other day, we had to draw fresh blood for the research. And the professor had a vasovagal with drawing blood. So every day he had to lay down. I draw his blood, get completely white, pale, and just shaking.
That's exactly what happened to me.
Yeah.
And I feel the blood leaving
day,
the body, and it's like, and I just.
If there's anything hinting towards any sort of like blood or anything like that, like even watching a movie, I do this.
Tom,
I can't.
He is this. The next show we'll go ahead and do with him. I'll tell you about all his stories about how squeamish he is.
Oh my God.
Exactly.
Well, like my wife Shonda, we have 2 kids, 2 C-sections, right? So she's a champ. She's a warrior. I had to turn my back. I thought I needed treatment. You know what I mean? I'm not looking at any of this stuff. I can't handle it. I don't know. I mean, you're born with it. You got to almost be born with that desire to just help people, and that's part of it. And just separate yourself from what they're going through. It's very admirable. It really is.
It's just training too. You just have to learn how to dissociate yourself a little bit. Yeah.
All right. Well, hey, if you're in the LA area, or I would even suggest traveling out here, one of the greatest facial plastic surgeons in the world is sitting right here, Dr. David Alessi, Alessi Facial Institute. Do you still have that special on breast implants that you were talking about?
Yep.
Okay, that sounds good. That sounds good. ENT specialist as well.
And the cross between Tom Zenner and Kato Kalin face, we do that really well too.
Yes. Yeah, I went to the hospital and said stroke patients. I got kicked out. Not a good thing to do.
We can let these two go on and on and on. All right, great topic, great show, guys. Thank you.
Where's your
the clinic?
Do you know where Ebaldi is in Beverly Hills?
Yeah.
My office is right above that.
You could catch the aromas from the kitchen.
Exactly,
It's right there on Cannon.
Yes.
Yeah, beautiful office. Amazing. Wow. So I'm not joking. If you need anything done, face, ENT, anything like that, this is your man right here. Not this guy.
Well, thank you for having me. Appreciate it much. Nice hanging out with you a little bit too.
I'm glad you made it in here.
Thank
really
you.
glad.
Was he as bad as you thought he was? He's got this bad reputation. Nobody likes Kato.
I still don't put the glove on afterwards. I know I said I was going to do that, but I don't want to.
All right, hey, check out all our content. Tom Zenner Scandal, man, we're approaching about 80 episodes. They're fantastic. Follow us. Follow the K Train over here on social media. Follow me. Follow our community page and check out our audio podcast as well. For the one and only K Train, Kato Kalin,
Tom Zenner in town.
Dr. David Alessi. I'm Tom Zenner. Tom Zenner Scandal. We'll catch you next time.